In this video, we'll discuss about hypertension or high blood pressure. Normal 120/80. What is hypertension? It can be defined as blood pressure of 140/90 millimeter mercury or greater. So how we will define? 140/90 millimeter mercury or greater. Main goal of treatment is to decrease the risk of mortality of cardiovascular and renal morbidity. So main goal to treat decreases the risk of mortality of cardiovascular and renal morbidity. The sign and symptoms of hypertension including headache, dyspnea, blood pressure more than 140/90, then retinopathy, visual changes, chest pain, sensory or motor problem. These can also be sign of end organ damage due to hypertension if the hypertension is untreated and severe. So what are the main sign and symptoms? Headache, dyspnea, blood pressure more than or greater 140/90, retinopathy, chest pain, sensory or motor problems. This one dangerous condition, it will affected end organs if we cannot treat or severe. What are the risk factor? Risk factor for hypertension are obesity, high alcohol intake, metabolic syndrome, diabetes, high sodium intake, sleep apnea, dyslipidemia, old age and family history. So what are the risk factor? Obesity, high alcohol intake, metabolic syndrome, diabetes, high sodium intake, sleep apnea, dyslipidemia, old age and family history. Hypertension can be categorized as primary and secondary. Primary is also known as multifactorial disorder because of genetics and obesity. Primary one because of genetic and obesity. Secondary hypertension causing. It include core station of aorta, pheochromocytoma, hyperaldosteronism, Cushing syndrome, renal artery stenosis, chronic kidney disease, polycystic kidney disease, nephritic and nephrotic syndrome, obstructive uropathy, hyper and hypothyroidism, hyperthyroidism and hyperparathyroidism. So what are the symptoms include? Comes under secondary hypertension. Core station of aorta, pheochromocytoma, hyperaldosteronism, Cushing disease, renal artery stenosis, chronic kidney disease, polycystic kidney disease, nephritic and nephrotic syndrome, finally hyperthyroidism and hyperparathyroidism. Next, pathophysiology of hypertension. Blood pressure is equal to cardiac output and total peripheral resistance. Blood pressure is equal to cardiac output and total peripheral resistance. When these two value it have changes, it will affected blood pressure. Two value changes means it will affected that blood pressure. It will change blood pressure. So pathological vascular changes that occur in hypertension occur slowly. That pathological vascular changes occur in hypertension slowly. Normal vessels, this one is the normal vessels. Normal vessels having good blood flow. However, in hypertension, as the hypertension vessels, there is a vascular changes. Here vascular changes will occur. Vascular changes, remodeling and hypertrophy. In the early stage, you begin to have plaque. Early stage we have plaque. Build up and thickening of the vessel wall. In the late stage, you get even more plaque buildup and hypertrophy. Due to why that plaque formation? Due to dysfunctions of endothelial vascular wall. Due to dysfunctions of endothelial vascular wall, you get hypertrophy also. All these changes result in narrowing that lumen. Because of narrowing that lumen and build up that vascular pressure, resulting in aggravating hypertension. So narrowing that lumen and build up that vascular pressure, resulting aggravating hypertension. So it leads to end organ damage. End organ damage including stroke, retinopathy, transient ischemic attack, then left ventricular hypertrophy, cardiac failure and renal failure. Then some investigation that should be performed in the patient with hypertension include ECG, electrocardiogram to check for cardiac function. Then urine analysis for renal function and serological tests such as plasma renin, aldosterone, thyroid function and blood count test to rule out other differential and to monitor hypertension. Then management. Hypertension include how to manage exercise, reducing salt intake, proper diet, limit alcohol intake or avoid alcohol, then use of anti-hypertensive such as ACE inhibitor. How to manage exercise, reducing salt intake, proper diet, avoid alcohol, use antihypertensive ACE inhibitor. Thanks for watching.